In this episode, we talk all about ski and snowboarding injuries. I had the pleasure of interviewing an orthopedic surgeon, Dr. Jonathan Frank from Beverly Hills, California, who is part of the U.S. ski and snowboarding teams. He shared a lot of his personal experiences as he travels with the U.S. ski and snowboarding teams, what decisions they have to make when someone goes down with an injury on the slopes, and what surgery may look like for people that have sustained ski and snowboarding injuries. But even more important, we talked about prehab, what it takes to actually prepare yourself to get ready on the slopes, especially us that aren't high-level athletes, that are your weekend warrior. What are some of the things that we need to do before we head out for a weekend on the slopes for fresh powder?
The Prehab audio experience will teach you how to take control of your health through knowledge by optimizing performance, promoting longevity, and keeping your movement system in tune. Welcome to your host, the Prehab Guys.
Dr. Jonathan Frank is a sports orthopedic surgeon from Beverly Hills, California. He attended UCLA, go Bruins, by the way, for undergrad with a dual degree in history and molecular cell and developmental biology, as well as minoring in Near Eastern languages and cultures, and completed his medical degree at the UCLA School of Medicine. After medical school, he completed his orthopedic residency at Rush University in Chicago, where he worked with the Chicago White Sox, Chicago Bulls, among many other collegiate and professional teams. After that, he completed a fellowship in sports medicine at the Steadman Clinic in Vail, Colorado, and to this day continues to take care of elite athletes as a member of the medical staff for the U.S. ski and snowboarding teams. Which brings us to our talk today regarding snowboard injuries for elite-level athletes like Lindsey Vonn, as well as other high-level athletes like Kevin Durant, Klay Thompson. We're going to talk about accelerated return after these recent injuries in the NBA and all things injuries and athletes. Dr. Frank, how's it going?
Hey, good. How you doing, man?
Good. Love it. Go Bruins, by the way. I didn't know you went to UCLA until I started reading up. I rep Bruins hard. I went to SC for grad school, but I don't rep anything UCLA. Anything USC. Like not a single thing. No shirt, no nothing.
Well, that's a true Bruin right there. You know, unlike I have a cousin who went there for dental school, and I got USC and I got Bruins. I was like,
Like, no, that's not how it works.
yeah. No, once a Bruin, always a Bruin.
Always a Bruin. They made me, so it's funny. I went to PT school, grad school, SC. It's actually part of the dental school there. I'm not sure how it works, but it's part of the Herman. I don't know. I remember what it's called.
Herman Oscar, I think.
Herman Oscar, yeah. They made us buy polo shirts that said USC Division of Biokinesiology and Physical Therapy, or it was before we even went to school. So I just was like, oh, I have to probably wear these on, rotations, not knowing that I didn't. And then I have it. Really haven't worn it at all.
Well, now you can burn it at a game.
Oh, that would be. Oh, yes. There we go. I'm hoping Chip Kelly turns it around this year.
I think he will.
He ended well last year. That was a good game. The game at the end. So for you guys listening out there, Dr. Frank you've been serving on the U.S. ski and snowboard team. He said for at least the last couple of years. Is that correct?
Yeah, since fellowship, we take care. The Steadman Clinic is one of the U.S. Olympic centers, and so we are one of the U.S. ski and snowboard team physician locations. So Lindsey Vonn had her surgery there. A number of Olympians have had their surgeries there and been visited there. So I got involved that way. All the fellows became one of the staff team physicians, and then you have the option to continue to be one of the staff team physicians after you finish fellowship. So I hung around.
That's nice. Tell us about what has that experience been like for you, working with those athletes there when you're in fellowship, and then now that you're in LA, how does that work with you, the travel and getting up in the ski and snowboard season, considering we don't have as much snow as they do in Colorado here in LA.
We've had some pretty good years the past couple of years in California. We've had record snowfalls, so it's actually been pretty good. But, those athletes are incredibly dedicated, incredibly humble, and very nice. You think that they're sort of difficult to talk to or unreachable, but, even Lindsey Vonn, super nice. I remember taking care of one of the Olympic gold medalist skiers, and this girl has been through so much. She's had multiple surgeries and was actually doing the salvage procedure to try to get back for one more season.
Wow.
And, you got to think about the level of dedication you have to have and love for the sport for her to go through what she did, all the surgeries, procedures, in order to try to get one more season on the slopes and try to make something before she retires. I was just in awe. I just couldn't believe it. Unfortunately, she didn't win any medals that year, but she definitely got back on the slopes despite all her injuries. And I think that's the thing that's been really an honor to be working with those athletes, is that, they have so much dedication, so much perseverance, that it kind of puts things in a perspective for you and makes you realize that you can accomplish a lot if you just work through the hurdles that that are placed in front of you.
Oh yeah. And it peeves me sometimes when I hear people say, "Oh, what do you mean?" Like they're upset they can't ski or something like that. I'm like, come on, give me a break. It's so much more to that. It's so much more to them, to what it is. That may be their livelihood. That may be the way that they put food on the table, and the amount of dedication, like you're saying, and just perseverance and just grit and work that it took to even get to that stage. That's something that the majority of us average people will never even be able to comprehend unless we've been put in that, situation before. So yeah, the amount of work that goes into it, it's crazy.
Absolutely. I mean, you got to think about it. Obviously there's raw talent, but you gotta grow that talent. You gotta, make sure that, these guys start when they're kids. They're on ski teams, clubs. They're going, all year round, and then to get better. And then they can't just sit on their laurels once they're at the top. They got to keep getting better and better and better, right?
Mm-hmm.
I think recently, if you look at the Michael Phelps, he had a couple of records that just got broken, right? Mm-hmm. He had records that were around, I think, for the past 12 years, and they just got broken in the world races. And I was like, think about that, right? Michael Phelps, when he had these records, people were like, no way anyone's ever going to break these records.
Yep.
And they got broken, right?
Yeah.
So the point is, like, people train, they have a goal. It's possible. They're just going to keep working hard. It's the same thing at anything we do, right? So for me, going to become an orthopedic surgeon, I had to go to college. I had to go to medical school. I did research. I have publications. I went to fellowship, and I still go to training seminars and keep reading and keep learning, because things are constantly changing, right? So these guys, put their whole body down on the line. Their entire life is dedicated to their profession. They're training 365. They're in the gym. They're on the slopes. There's no vacation really for these guys for them to be at that level.
Yeah, it's work all year round. Off season is just more training. Yeah, they have a couple weeks of rest, but then they're right back at it again. They just might not be on TV where you see them.
Exactly. And that's the thing, when you watch them going down the slopes, they're not getting injured unless they, have a bad edge and go flying off because they have such great preconditioning. So, one of the things that I noticed when I was in Vail was the gym there would actually put on a 6-week course before ski season started, to get people preconditioned in order to get them ready to be on the slopes, right? So that would be a lot of squats, lunges, getting them ready stamina-wise, stretching exercises, because if you just go from doing nothing or not being ready for the slopes and get on the slopes, you're at a higher risk of injury, right?
Yeah.
So we saw a lot of these people who came from across the world to come ski in Vail, because Vail is one of those destinations. And they didn't do anything all year round. They were just the guy who goes to the gym and doesn't really stretch, does mostly upper body workout because that's what everybody sees. And they get injured. They get catastrophic injuries. We're talking about multi-ligament knee injuries, proximal humerus fractures, clavicle fractures, just plateau fractures, really bad injuries. Because when you're going, 20 miles an hour down a slope and you take a tumble, you're taking it bad.
Oh yeah. I love what you said about what they're doing in Vail. We had a talk with actually Dr. No at Rush. I think you said you did your fellowship there, right?
Yeah, I know Dr. No. He's a friend of mine.
Yeah, we were talking about preseason and the high incidence of injuries in preseason for a lot of these high level athletes, and it's because, like we were talking about off season. Well, for most of them, it's not a real off season. You know what I mean? Yeah, they're taking some time off, but they should still be maintaining that baseline level of fitness or baseline, general strength. So that way, when they get into the off season, they're not at the higher risk. And it sounds like the Vail Clinic, that's what they were putting their people through before they even got on the slopes, which would be considered their quote preseason, because they may not be at a race yet, but they're just like starting to hit the slopes, which you can't do until there's snow. But they're training hard in that time before then, so that way their bodies are adequately prepared for that whatever intensity or whatever activity that they need to be able to compete in. I think that's so important, and we miss that too much. We just want to hop on the slopes. Oh, it's snowing. We're gonna go up to the slopes today.
Yeah, unfortunately, we're not 16 for our whole lives, where we're able to just bounce back right away and can take awkward positions. As we get older, our bodies are just not as pliable anymore, and we just got to do things to make sure that they're optimized so that we can decrease our risk of injury. Obviously, injuries occur. Elite level athletes get injured, even though they're in peak condition. But for us weekend warriors, we got to do whatever we can to make sure we decrease our risk as much as possible. I mean, look at Tom Brady, right? That guy is still going. He's still at the top of his game. And like you had pointed out, the reason is during the off season, he's still hitting the gym. He's still working out. He's spending more time with his family because he's not traveling around, but he's still hitting the gym where he is.
Oh yeah. I wish I were going back to Tom Brady. For people that don't like him, but I respect him so much for what you just said, that he's been able to maintain that level of play for so long, and he takes care of his body very much like a LeBron. Although LeBron's season last year, he's starting to, quote unquote, finally miss some games, which is just normal. He hasn't missed games for the longest time because he takes care of his body so well. Which, going back to what you're saying, so I went snowboarding twice this last season. I was so sore after each one. Like so sore. And I remember as a kid, I used to have a season pass. I grew up in Sacramento, so I was really close to Tahoe. I used to be able to go 3 days in a row, like a Friday, Saturday, Sunday, no issues at all. And now it's like I'm only 28 and I'm already sore after one day, but it just leads to show that my training, even though I am, going to the gym, that's not even enough for the demands that were placed on my body in one day of snowboarding. So say people are thinking about going snowboarding, we'll say skiing for right now. Those people need to do more like quad dominant exercises for maybe a couple of weeks leading up into it. You got to get your knee used to that load, or you're going to come back with some patellar tendonitis. Or your knee's just not going to be as happy, with you as if you had done some preparation before. That's our, average Joe weekend warriors, off season conditioning in comparison to athletes. But we got to do something if you want your body to perform at a certain level. You got to prep it for that.
Exactly. Yeah. And, it can't be stressed enough. We just got to be, we go to the gym, we work out all these major muscle groups, but we never think about the small muscle groups. And we never put our knees in a position where you're in a semi-squat position for the entire day, right? Mm-hmm. So you're semi-squat and you're just pivoting, twisting the whole time, right? And we don't work out that way, right? So we got to do exercises that prepare us to be in those positions all day or for half the day or whatnot. And it's just like anything else we do in life, right? If you're going to go on a camping trip, you make sure that you have all the stuff you need to go camping. Otherwise, you're not going to have it on the trip, right? Yeah. So it's that forward planning that you need to have in order to be ready for the slopes as well, especially as we get older.
Yeah. 100%. I love that example. That's usually what I like to give to some patients. A lot of my ACLs that are itching to get on the slopes and they're not ready or they haven't been cleared. I'm like, think about this. Like what you said, you're on a long, say you're going to North Star or one of those long places. You're on, if say you don't take any breaks, if you're able to, you're in a squat position for like 10, 15 minutes with all the pivoting and turns and the coordination and the central fatigue, not fatiguing as you're riding down to avoid, catching an edge. That is tough. In the clinic as a PT, I can try to do everything I can and mimic those environments. And granted, that's what my job is to do, but I'm never going to be able to put someone through that unless they actually go to it. So a conversation I like to have with people returning to whatever activity it is you have to take it in, progression. So say someone wants to get back on the slope. It's their first time. Well, say they're a great skier. Well, they're probably not going to go double diamonds right away. Let's start greens and then let's go blues and then let's go single diamonds. Or, limit their time. Okay, someone's not a good skier. Let's go a half day first, see how you feel. Then go, 3/4 of a day, then a full day. Because that's now conditioning for the body, again, to prepare them for a full day of double diamonds or whatever it may be.
Yeah, it's difficult for a lot of people to get time off and, to do something along those lines where they ease into it just because, say they go for Thanksgiving weekend and that's all they're going to have the whole year. So they go ham, right? They go all out from day one, especially if that's their personality. It's just,
Yeah.
go full throttle all the way. But, you can do that, right? But you got to realize you're taking risks when you do that, number one. But number two, you also got to prepare for that, right? So you got to do certain exercises, like you were saying, trying to prepare our patients or to be ready to take on the slopes or take on the basketball court after they've had an ACL reconstruction, or, tennis after they've had some sort of ACL reconstruction, because everything has its own demands. And if you're not ready for it, you're setting yourself up for another injury or for failure.
100%. 100%. We try to, put that mindset into people as much as we can. And our bodies are amazing at adapting, but it takes time for them to adapt to whatever it is that we want them to. But our bodies are amazing at doing so. Love it. Love it. Love it. Love it.
Absolutely. And you see that really well with arthritis. Arthritis is this progressive disease that we all face as we get older. We have wear and tear on our bodies. And I'll have patients who have terrible arthritis, but up until they just had a fall the other day and they're like, I'm in pain. I don't know why I have so much pain. I was like, well, you have arthritis, but because it's this slow progressive issue, you never really experience pain from it. And now you've upset that balance. You've upset the equilibrium your body has been able to achieve all these decades. And, we all do what we can to help them get back to that equilibrium, whether it's injections, physical therapy, anti-inflammatories. But getting back to your point, our bodies adapt to that progressive disease. And we have no idea we have severe arthritis until we upset that equilibrium.
Yep. Until something upsets that equilibrium, then there's now a pain trigger. And then, 100%. We see people in pain all the time. It's hard to explain to people a lot of times. They're like, what do you mean? I just got arthritis. It's like, I just got arthritis. My knee hurts because I have arthritis. But you've had it for years and years and years. It's a slow, chronic degenerative disease. And just now there's some sort of trigger that triggered it. So you're in this current pain cycle. But just as, I don't want to say just as easily as you got into it, we can also, through many other means, get you out of that as well, even though the arthritis is still going to be there. And it's trying to paint that picture for patients and get them to realize that they're more than just what their knee looks like, on a picture.
Yeah, I think the best example I give to patients that's worked for me is that I tell them, look, think back when you were 16, you woke up, you didn't feel stiff at all. You felt ready to go and take on the world, right? Now that you're 50, when you wake up in the morning, you're stiff, right? You got to warm up, you take a shower or whatnot. And as the day goes on, you feel more limber. Well, what happened? What changed, right? It's because our body's just slowly wasting away. We're aging. It is what it is, right? We're eventually going to meet our makers. And it's this slow progressive change in our body we're all trying to prevent or delay by staying fit, staying active, staying limber. Stem cells is a promising frontier that we're all trying to explore and figure out and understand how and when best to use it, and PRP injections, all these biological options. But nonetheless, our bodies are slowly degrading over time. And it's the same thing with arthritis. That's what arthritis is, a slow progressive disease, usually, unless it's traumatic, that occurs over time, just like the creaks that we all feel as we get older. And it starts to click with them and they're like, you're right. I don't feel like I was when I was 16. And that's because my body is breaking down over time. And that helps them conceptualize arthritis a little bit better. At least it has for me when talking to them about it.
Yeah. And it's like it's a normal expected thing. But yes, there's things you can also do to help slow it down, but it's just part of life.
Exactly.
Like nothing bad. Like God didn't just choose you for this to happen, This is normal. We're all getting older,
right?
Yeah. Speaking of, so you mentioned ACL injuries a while ago. Earlier we were talking about Klay Thompson's injury in the NBA. For those of you guys don't know, it was the NBA Finals. He's from the Warriors. I think it was Game 6. I want to say he went up for a layup, was contacted in the air. I think it was just an ACL tear, I believe, right?
No, he had an MCL sprain, which is a partial tear as well.
Okay, so an MCL sprain as well.
Yeah.
So he had surgery, and then we were talking about accelerated timelines. What are your thoughts on accelerated ACL rehab timelines, just ACL rehab in general, in regard, I guess we'd say in regards to Clay?
Yeah, so it's a good question. ACL reconstruction is one of those things that's evolved over time. If you think about it, when we first did ACL reconstructions, patients would be in the hospital for a week and they'd be in a cast and be immobilized. We realized that's not a good thing for them because they develop scar tissue to get really stiff. So over time, things have changed. Now it's an outpatient procedure. It takes 45 minutes, 30 minutes, 45 minutes to do. Patients start mobilizing right away. So for me, for patients, whether it's accelerated rehab or just a general run-of-the-mill patient who wants to get back to their weekend recreational activities, it's a stepwise approach. The first thing I want is to work on motion and quad activation. So what happens is when you do an ACL reconstruction, the quad shuts down. We got to wake it back up. The quadriceps is so important for protecting the knee as well as the graft as it's healing and being incorporated into the knee as a ligament. So quad activation exercises, range of motion exercises, paramount. Once they reach that goal, their quad is activated, they're able to perform a straight leg raise without a lag, they've got full motion, then you start progressing things, right? You start throwing in squats, you start throwing in lunges, abductor exercises, because you got to remember the core is everything from the nipples down to the knee, and that all controls the knee. So if you have a weak core, you have a weak abductor, you have weak quads, you're going to have an issue, right? So for me, it's a stepwise approach. We work on motion, we work on quad activation. Once they reach those goals, then we start work them along the lines of getting them to a point where they can start hopping from one leg to another, because that's really going to be the determination of whether they can go back to playing sports, right? So, there's been a lot of studies looking at what functional tests you should have an athlete do in order to make sure that they're ready to get back to sport. There's the vertical jump test, single leg hop distance test, the time single leg hop. All these tests are static tests, right? You got to think that just capturing the athlete at one time point, but you also got to then take into consideration what are they trying to get back into, right? So a lineman is going to have very different needs than a running back or a point guard for basketball. Everyone has different needs and different stresses on their knee. So then you got to run them through drills to make sure they're ready to go back to playing sport. And so it's very important to realize that everyone's not the same. Everyone has different goals, different stresses that they have to be able to achieve when they're getting back to their activities. And it's going to take some time to get them there. The fastest I've gotten an athlete back to practicing with their team was about 4 months, right? And you got to keep in mind, this is a professional athlete who is doing 2-a-day physical therapies 5 days a week, right? Every single week until they got back to playing.
Yeah.
That's not feasible for most people. We have jobs. We have to provide a living and put a roof over our heads. We don't have that ability to spend that much time every single day, 5 days a week going to therapy. It's also very expensive. But, for a professional athlete, that is their job, right? So going back to playing basketball, this is their job 24/7. So for them to go twice a day, every single week, until they're back at 4 months on the court is doable for them. It's not doable for most of us, though.
No, that's quick. That is really quick. Not doable for most of us, for sure. That's crazy. I guess so these accelerated protocols, there's nothing on the surgical side that is done differently, correct? It's just the time points and when you're clearing them for certain activities on the rehab side.
So yes and no. I do something different for my athletes who I want to do an accelerated rehab. I do an added procedure where I do an internal brace. Basically, I create a strand. I put a strand of suture. It's a special suture that has a high tensity to it that goes along the same route as the ACL reconstruction. And what it does is it helps decrease stress on the graft as you're healing, so that you're not putting too much tension on it and stretch it out. So I do an internal brace for all my athletes and all my revision ACLs to decrease the risk of having a stretched out graft or a re-rupture.
Got it. Okay, that makes sense. Because when I've seen some of these accelerated protocols, I'm like, well, that's that's what you should be doing all the time. And it just usually for most people is, well, they're just not there at that time. So it just ends up being that they're at the normal, quote unquote, normal time frame of where the protocols are, if that kind of makes sense. I'm like, well, as long as if they look this strong at this point, of course we're going to progress to that. And as long as they look good at this point, of course I'm going to progress to that. But yeah, all contingent on that they pass certain parameters or whatever you're looking at that stage to go on to the next one.
Exactly. Like phase one is going to be about getting the swelling down, getting their motion back, getting the quad activated. Phase two is going to be about the quad control, right? Making sure they have good mobility, good quad control. They're able to walk with a limp. So there's different phases. There's about 5 phases for an accelerated return to play. And so it's going to be every one of those time points have to be met before you can get to the next phase. Correct. Now, unfortunately, there's only so much you can do to accelerate biological healing too, right? So it's not just time points and what they're able to achieve, but we also have to take into consideration the biology, right? So it takes up to 18 months or longer for a graft to fully incorporate and have no changes that are occurring biologically. So that's a fully incorporated graft. And it takes even longer if it's an allograft where you're using a cadaver graft. That being said, it's still functional. It's still doing everything you want to do, and it's quote unquote healed. We got to keep that in, as orthopedic surgeons, we know all these other facts that patients may not understand, and so when we're trying to slow them down for their own benefit, it's because you can only push biology so far.
Yeah, and with the goal of that brace then is that as someone's in those higher level activities, potentially we're taking some of the stresses off the actual graft itself and putting it on that the internal brace instead. That's basically the thought process behind it?
Exactly. That's the theory. That's the same reason why you might wear functional ACL brace after an ACL reconstruction, so that for those first 3 months you're doing whatever you can to decrease the stress on the graft as you're getting more control of the leg, getting the quad activated, getting the muscle bulk back. So the studies for functional braces for prevention during sports have not been promising. I don't think any studies have really been done looking at an ACL functional brace to prevent stretching of the graft during the rehabilitation. But it's something that is an insurance policy, right? So if it's something that will help or potentially help, then why not do it? The idea behind the internal brace is the exact same thing. We have a brace inside the knee to help decrease the stress on the graft so that we don't stretch it out as we're going from phase 1 to 2 to 3, etc.
Got it. When those Don Joy braces, when I guess something I was thinking of when it came to skiing and snowboarding, kind of the topic we were going to talk about. Are those braces going to help someone more from quote contact injuries and from more non-contact than contact injuries? Am I saying that right?
Yeah, no, you're saying it right.
Yeah.
There's no evidence to say that it's going to prevent them from having an injury of the ACL when they're wearing a brace. But there's no downside to wearing the brace. Does that make sense?
Yeah.
There's not been any study to say, hey, if you wear an ACL brace, or like you said, the Don Joy is one of the companies that makes that brace, whether that's going to prevent ski injuries. There hasn't been a study to show that. But it goes to it would make sense that if the knee can't bend in the ways that are going to tear up the knee, it's probably going to protect you to some degree. Mm-hmm. Right? So if you were set up to tear all 4 ligaments in your knee, now with this brace, maybe you only tear 1 ligament, 2 ligaments maybe, instead of having full knee dislocation, right? Because it's still going to restrict how your knee is going to twist and turn inside the brace.
Is it common practice then, taking it back to skiing, that, like, so for example, like Lindsey Vonn or something like that, that if they're going to return, they're going to be in one of those knee braces, or for all skiers? Is that common practice or no?
No, it's not common practice. And if you saw Lindsey Vonn at the last Olympics, you saw she was not wearing any braces, right? And she's had multiple injuries.
Yeah.
It's going to be impossible for these athletes to do like a Super G in a brace. They're not going to be able to get the pivot, the twist, and have the time that they need in order to be in the Olympics.
Got it.
It just restricts you too much.
Too much.
Yeah.
Okay.
But if it's you or I, we're just trying to get down the slope alive, it's useful, right?
Yeah. Yeah. What is it like being on the silence, is that the right word, when you're at these competitions and someone goes down? Are you the one that's going out there? What happens when people get hurt? Like, how does that triage really look like?
Yeah, so it really depends on what sort of fall or tumble the athlete takes. If it's a small fall and it's nothing terrible, you let the slope team sort of take to the trainers sort of take the lead. If someone goes over the barrier and takes a nasty fall where they got a lot of lift, you got to get there pretty fast because they can have a pneumothorax, which is a collapse of the lung and not breathing very well. You got to put a chest tube in them. They can have an open fracture where the bone is sticking out, and you got to reduce it as quickly as possible. So it just all depends on what sort of tumble they take. You try to be also respectful of the host nation because they have their own doctors as well. But you're there looking after your U.S. athletes' best interests, so you want to be there at the same time. But it's not just when they get injured you got to take into consideration. A lot of these athletes, especially if they finish in the top three, they get rushed by by a group of people, and there's all this excitement. And someone can hand them something that may be a banned substance in water, and the athlete can drink it, and
Crazy.
they may get a urine test right after they've won like a bronze or a gold, and fail because they just drink this thinking it's water, right? And pretty cutthroat. Nobody knows. It's pretty cutthroat, these competitions. And so, as a staff team physician, you have to go with the athlete when they go and get a urine test, because you never know who's going to try to do something or contaminate the urine test. It's pretty crazy. I think there was that documentary about I think with the Russians, tampering with the samples as well. If you remember that.
Oh yeah, I remember hearing about that. Their own samples, right?
Exactly.
Yeah.
So, there's people out there who are trying to get their country on the podium versus your country, right? So it is. I mean, when I as a physician went through training and heard these stories, I was like, this is crazy, right? You got to knock out someone's water that they're trying to hand to your player. You got to be ready for that because they might try to be doping them so that they fail the urine test.
That's insane.
So it's pretty crazy, with the stuff that you think about, because you think, oh, it's, you're there just in case they take a bad tumble to help them. But, you're also there to make sure that no one tries to hurt them.
Yeah. So when you're in another country, you mentioned this earlier before we hopped on, not having it's something that never crossed my mind, not having a medical license. If you're traveling with the team and you're in Germany or you're in another country, not in U.S. soil, and you're not licensed there, how does that work with someone actually needs care? Like what's that decision making look like on the medical team side?
Yeah. So, like you said, you don't have a medical license to practice there. So you can't take them to the OR and rod a tibia if they break their shin bone. So what you're there for is to really help stabilize the player or the athlete, make sure that they're being taken care of appropriately, that no one's doing something that's not to the standard of care. And if it's something that can be taken care of in a non-acute fashion, get them ready for transportation to the U.S. so they can get their surgery, right? So, obviously if someone takes a massive tumble where their lung is collapsed and they're going to be on a respirator, they're going to stay in that country until they're stable, right? Mm-hmm. But, not every country has the same level of care as the U.S. So you're there as a medical professional to make sure that your athlete is being taken care of in a way that they would be if they were in the U.S. as well. So you're there as an observer. You're there to help make sure that they survive the slope and to get them ready for the next step, whether it's to stay there and get their care because it's very critical, or to get them to the U.S. they can get their care there.
I assume it's probably case by case, but like when you, as a staff, like team, when you go to say like another country, do you already have like certain providers or surgeons that you're like, well, if something were to happen, if this were to happen, we feel comfortable with like this like surgeon operating, or is the goal always let's get them back to the US, or is it like, if not, we feel comfortable with X, Y, and Z doctors performing X, Y, and Z surgeries? Is that something that you guys have to think about beforehand, or
Yeah, so the U.S. ski and snowboard team already has a plan for every slope or every terrain that they go to. So they know exactly where the hospital is that they're going to either transport to if they have to go to the hospital. You have, your medic bag on you as well as the trainer has it. So everyone's ready and knows what the plan is for each one of the locations that the team goes to know exactly what the plan is, plan A, plan B, right? Because if you don't have that, then you're just left there holding, in your hands and not knowing what to do while the player's there in pain and God forbid, on the verge of dying, right?
Yeah.
So it's well thought out, because there's some terrains where you can't even bring a helicopter in, right? So if they get a bad injury and it's urgent, like, what are you going to do? Where do you have to take them for them to get their transportation to the hospital, right? So that plan is already made ahead of time, and everyone knows what the plan is if that happens.
And is that plan though different from team to team in terms of Team USA prefers their athletes to go to this hospital or is it like, do you know what I mean? Like versus team, like, is it going to be different based on the country, or is that this is where everyone from, this location or this competition is going to?
I don't know the answer to that. Yeah, I don't know the answer to that. I would think that it would be the same hospital that most, industrialized countries would use, the same place, because everyone had, Australia, England, we all have the same sort of healthcare system in terms of the level of care that we provide and the way we treat patients, versus, some place, I don't know, I don't want to say a country and get in trouble, but you know what I mean? There's third world countries that have a different level of care and a different approach. It may not be what we do or would want for our patients, and so they may choose a different hospital or have no preference. So, if you get injured in Switzerland, it's very different than getting injured in, Russia or China or one of those other countries, because it's just, Switzerland has a very similar approach to trauma as the U.S.
Got it. A lot that goes into preparation, that's for sure.
Yep. Just like getting ready to go on the slopes, right?
Yeah. Hey, it's prepping the other side. It's the other side of things that, the average, I would say the average Joe, the weekend warrior may not see, but just like they had to prep for the slopes, you had to prep for taking care of the people on the slopes, same exact way.
Exactly. It's the same thing, preparing for surgery. You got to get the MRI, get the x-rays, see the patient, evaluate them, do a clinical examination, and have a conversation, and then you have a surgical plan, right? And it's different for everybody, right? One 30-year-old male who tears his ACL is not the same as another 30-year-old male who tears his ACL, or a 30-year-old female who tears their ACL. So everyone's different. Every plan is going to be different, and it's the same thing. Everything is about planning.
Love it. I love that. With that, I think, so one question we've been asking every guest, and I'll ask you, what does prehab mean to you? Have you answered that, and then we'll start to wrap up.
Sure. So prehab to me means preparing for whatever activity or sport you want to get into, whether it's to get back to go skiing, snowboarding, playing basketball, playing football, or maybe you're the jack of all trades. You want to play all sports. So prehab to me is just being ready for the rigors of whatever activity you want to get into.
Love it. Love it. Love it. Dr. Frank, any other closing statements you want to add? Definitely, where can people find you also, in person, social media?
Absolutely. Sorry?
No, go for it.
So I have an Instagram. It's LA_sportsdoc. I have a Twitter account. That's the same thing. My website is frankmd.com, and my office is in Beverly Hills. My phone number, if anybody wants it, is 310-247-0466. On my website is the direct email to me. So if anybody wants to email me, they can email me directly off the website. It's doctor@frankmd.com. It's also on my Instagram account.
Awesome. Really appreciate your time, Dr. Frank. Again, that was super informative talk. Prehab is preparation. It's preparing yourself for the demands that you want to get back into it. And it can look different for you, look different for me. It's going to look different for all of us. But as long as, you guys are understanding that you have to prep for some sort of physical activity to put yourself in the best environment to not only perform at a high level, but to decrease your risk of injuries. That's really where the key is. And I think you really harped on that. Preparation is so important for all aspects of life, but especially when it comes to our I learned a lot right there. I hope you guys did too. That was crazy, the stories about the doping. That's just crazy that as a medical provider that you have to be trained upon how to watch out for your athlete and make sure they don't drink anything after winning. That's just gnarly to me. If you love the stories, if you love the conversations that we're having, please give us a review on iTunes, on Stitcher, on Google Play, whatever you may be listening to. The reviews really, really help us a lot. If you want to follow Dr. Frank, we're going to leave all the information in the show notes, and let us know if there's anyone else you guys want us to interview.